research was really motivated by a goal of understanding more about rare genetic differences that we know are associated with autism and other neurodevelopmental conditions. So we know that there are a whole variety of genetic differences that can lead to autism and other conditions, but we don't know a lot about the other mental health features that they might bring along with them, even though we know that people with autism are at increased risk of difficulties like anxiety and depression, ADHD, and more challenging behaviors. So the goal here really was to think about whether there's specificity between some of the genetic variants linked to autism and some of the patterns or profiles of mental health or behavioral difficulties that some of those people might experience. We focused on a group of children and adolescents who had genetic variants in one of 3 genes linked to autism. So these genes were CHD8, DYRK1A, and ADNP. So we wanted to ask whether we saw those patterns of specificity in those behaviors of anxiety, depression, ADHD, or what's called oppositional behavior, whether we saw the same patterns across all of those different gene groups, or whether we saw some sort of specific relationships between those different genes and outcomes for those children and adolescents. And we also wanted to know whether there was anything about those children's early development that might give some idea about the mental health concerns they'd have later. Data for this project come from a very long-standing study at the University of Washington that's been a multidisciplinary collaboration for years. So we have researchers involved in genetics, we have psychologists, we have a lot of students and trainees, and we had some support from family organizations who helped us find interested families who might be interested in enrolling. So once families with one of these gene events were enrolled in the study, they shared a lot of information with us through really comprehensive clinical assessments. And originally these were done in person. Families would come to Seattle for a couple of days and really share a lot. But more recently, we've been able to move more flexibly into virtual assessment, and that's allowed more families from more places to participate a lot more easily. So the families really did assessments that covered a lot of ground. So we had cognitive skills, communication and language, motor skills, social behavior, mental health, and many more things. And within that, parents filled out a questionnaire that's really well established called the Child Behavior Checklist. And this asks them to rate a lot of different behaviors that they see. And then we're able to pull scores related to anxiety, depression, ADHD, and oppositional behavior. It's 4 behavioral areas. And then we're able to look at the patterns or the profiles across those 4 areas that we see in those 3 gene groups to see if there might be anything specific to those groups. We also pulled some information from parent interviews about early developmental milestones so that we could see again if there's anything early in life that is helpful. So we pulled information related to when children first began to walk independently, when they began to use single words, and whether they ever experienced something called a developmental regression, which is when someone seems to lose skills that they had, or they seem to kind of move backwards in terms of their development. So then we're able to plot those different behavioral areas across those groups and look for areas that might be elevated for particular groups or might be relatively low concern for those different groups. So from our data, it looks like there may be some specificity among those different gene groups in terms of the behavioral features that we're seeing. So for example, in our group with CHD8, it looks like internalizing features might be the most prominent. So we saw elevations in anxiety features and elevations in depressive features or symptoms, but we saw relatively fewer concerns in terms of ADHD or oppositional behavior. So that tells us that internalizing behaviors might be an area of more concern for kids with CHD8 differences. In our DYRK1A group, we saw something different. We saw that depression is again elevated, but so is ADHD, whereas anxiety and oppositional behavior are much lower. And then in our third group, those kids with differences in ADNP, we didn't see particular elevations. We saw a more consistent kind of level of behavioral difficulties across those different things that we considered. So it looks like there may actually be some different patterns between those groups. We also saw that age seems to matter. So with anxiety in particular, we saw that among the kids who participated who were younger, anxiety tended to be lower. and among the teens and adolescents who participated, anxiety tended to be higher. And so what this could mean is that anxiety symptoms become more problematic or more prominent as kids get older and develop. And we saw this for the group overall, but we also saw it most notably in our CHD8 and our ADNP groups. There are some clear clinical implications down the road, as well as some theoretical implications. So clinically, I think that this can be really helpful in understanding more fully what types of mental health concerns might come along with these genetic differences, so that families and care teams can be more prepared, can be screening or watching for difficulties, and can potentially catch them earlier. So for example, if a family knows that their child has a difference in a particular gene that might increase their risk for depression, they might be looking for that more carefully. They might be taking proactive measures, teaching coping skills, really paying attention to how their child's doing in that way, in a more careful way, or in a more informed way than if we didn't know about that elevated risk. In terms of next steps, we are continuing to enroll families in all of these gene groups in our work at the University of Washington. And so as our group gets larger and we get a wider variety of experiences among these families, we can begin to look at more detailed relationships. For example, we might be able to look at how these patterns of mental health features differ by sex assigned at birth. So we might find that matters. We don't know that yet. Our samples aren't big enough to look at those more specific details or pieces or factors, but that's what we may be able to do as we continue to enroll families.